Apple cider vinegar every morning, what it's doing to your teeth. Picture this. You wake up, mix a tablespoon of apple cider vinegar into a glass of water, drink it down, and feel like you just did something good for your body. Millions of people over 60 do exactly this every single morning. Some have done it for years. Few have ever asked what it is actually doing inside their body or what it might be quietly doing to their teeth. Apple cider vinegar has become one of the most talked about morning rituals in the wellness world. It is credited with everything from weight loss to blood sugar control to detoxing your entire system. Some of those claims are backed by real clinical trials. Others are exaggerated far beyond what the research actually shows. And there is one very real risk that almost nobody mentions, especially relevant after 60. Today, I am going to walk you through what the actual clinical research shows about drinking apple cider vinegar every morning, the real effect size you should expect, and exactly how to drink it without damaging your teeth or your esophagus. The third finding is the one most people get completely backwards. Stay with me. Before we get into the research, here is something most people do not understand about how apple cider vinegar actually works. The active ingredient is acetic acid, the compound responsible for vinegar's sour taste and sharp smell. Acetic acid appears to slow the rate at which carbohydrates are broken down and absorbed in your digestive tract, and it may also improve how your muscle cells take up glucose from your blood. Think of it as putting a gentle brake on how quickly sugar floods your bloodstream after a meal. It is a real, measurable, biological effect. The question that matters is how big that effect actually is. And the honest answer is modest, not magical. Now, what the research actually shows. Finding 1. A real but modest effect on fasting blood sugar. Multiple meta-analyses of randomized controlled trials have looked at this. A 2021 meta-analysis in BMC Complementary Medicine and Therapies, pooling 9 studies, found that apple cider vinegar significantly reduced fasting blood glucose by an average of about 8 milligrams per deciliter, along with a modest reduction in HbA1c and total cholesterol. A separate 2025 meta-analysis found a larger pooled reduction of close to 22 milligrams per deciliter in fasting glucose among people with type 2 diabetes specifically. The studies vary considerably in size and quality, but the direction is consistent. Apple cider vinegar appears to genuinely help fasting blood sugar, modestly, and more so in people who already have diabetes or pre-diabetes than in people with normal blood sugar. Margaret, a 64-year-old from Arizona with pre-diabetes, started 1 tablespoon of apple cider vinegar diluted in water each morning, alongside the dietary changes her doctor recommended. Over 12 weeks, her fasting glucose dropped from 116 to 104. She does not credit the vinegar alone, but she noticed the difference began roughly when she started. Finding 2. A bigger effect on after-meal blood sugar spikes. This is where the research gets more interesting. Several controlled trials have found that the effect of apple cider vinegar is strongest in the hour or 2 after eating a carbohydrate-heavy meal, not on fasting levels throughout the day. In these studies, vinegar consumed with or shortly before a meal blunted the after-meal glucose spike by roughly 10 to 20% compared to the same meal without vinegar. For someone managing pre-diabetes or type 2 diabetes, smoothing out that post-meal spike is genuinely valuable. It is one of the more well-supported uses of vinegar in the research. Finding 3. The weight loss effect is real but far smaller than the hype suggests. This is the one most people get completely backwards. Apple cider vinegar is marketed online as a weight loss miracle. A 2025 systematic review and meta-analysis in the journal Nutrients did find that apple cider vinegar produced statistically significant reductions in body weight, BMI, and waist circumference compared to placebo. But here is the honest context. The effect sizes across the included trials were small, typically a few pounds over 8 to 12 weeks, similar to or smaller than what you would expect from a modest reduction in daily calorie intake. It is not nothing. It is also nowhere close to the "lose 10 pounds in a week" claims that circulate online. Before we continue, let me say one quick thing. If you are finding this honest, balanced approach useful, the best way you can support this channel is hit that like button and subscribe. I read every single comment, and knowing this kind of straight information is helping people is what keeps me digging through the research instead of just repeating the hype. Now back to it. And now, the warning that matters most after 60, the one almost nobody talks about. Apple cider vinegar is acidic, with a pH typically between 2 and 3, roughly as acidic as orange juice. Drunk undiluted, or drunk frequently over years, that acid can erode tooth enamel, irritate the lining of your throat and esophagus, and in some documented case reports, cause throat burns when swallowed without enough dilution. After 60, your tooth enamel is already thinner from decades of wear, and your esophagus may be more sensitive due to age-related changes or acid reflux. This is not a reason to avoid apple cider vinegar. It is a reason to use it correctly. Robert, a 67-year-old who had been drinking straight apple cider vinegar shots every morning for nearly 2 years, mentioned to his dentist that his teeth had become noticeably more sensitive to hot and cold. His dentist examined his enamel and found visible erosion on the back of his front teeth, consistent with frequent acid exposure. He switched to properly diluting his vinegar and drinking it through a straw. His sensitivity improved over the following months, though the enamel damage itself does not reverse. So here is exactly how to do this correctly, based on what the research actually used. 1 to 2 tablespoons of apple cider vinegar, diluted in at least 8 ounces of water, never undiluted. Drink it through a straw to minimize contact with your teeth. Rinse your mouth with plain water afterward, but wait at least 30 minutes before brushing, since brushing right after acid exposure can actually abrade your already softened enamel. Taking it shortly before a carbohydrate-containing meal appears to provide the most consistent benefit for blood sugar. A few honest warnings before you go. If you take insulin, sulfonylureas, or other medications that lower blood sugar, apple cider vinegar can amplify their effect and increase your risk of hypoglycemia, dangerously low blood sugar. If you take digoxin or potassium-lowering diuretics, talk to your doctor, since vinegar may affect potassium levels with heavy, prolonged use. And if you have acid reflux, GERD, or a history of esophageal irritation, the acidity may worsen your symptoms. Consider discussing this with your doctor before starting a daily habit. If this video was useful, please tap the like button. It helps reach more people who deserve honest, balanced health information instead of online hype. And drop a comment below. Do you drink apple cider vinegar? And have you noticed it affecting your teeth? I read every single one. Disclaimer: this video is for educational purposes only and does not constitute medical advice. Always consult your doctor before starting daily apple cider vinegar, especially if you take diabetes medications blood pressure medications, diuretics, or have a history of acid reflux, esophageal conditions, or dental erosion. Apple cider vinegar is a food, not a treatment, and should never replace prescribed medical care.